Hypertension, also known as high blood pressure, is the number one cause of death worldwide. In order to correctly identify people with hypertension and treat them effectively, it is essential to use a blood pressure device that is both accurate and easy to operate. While different types of blood pressure devices are available, the ones that measure blood pressure automatically are ideal because they are accurate, easy to use, and require less maintenance. Non-automated devices, like mercury or aneroid types, rely on human factors for accurate measurement, such as adequately inflating the cuff and reading the numbers on the device dial or column to estimate the blood pressure. In addition, many countries do not allow mercury devices because mercury is toxic to the environment. For these reasons, many expert organizations, including the World Health Organization, currently recommend automated devices for measuring blood pressure in the upper arm. Wrist devices may not be accurate with typical clinical use, and thus are not recommended. Since there are many automated devices, it may be challenging to select the best one for your needs. This video will provide practical guidance on how to select the optimal automated blood pressure device for your clinical setting. There are 6 factors you need to consider when choosing an automated device. First, the source of power required to operate the device is a key factor. If a reliable power outlet is not available, then you should consider a device that uses disposable batteries, rechargeable batteries, or solar power to operate. A semi-automated device, which relies on a hand pump for cuff inflation, requires less electric power and is another option. Second, the skill and training of staff tasked with performing blood pressure measurements is important. Semi-automated devices require greater operator skill than fully automated ones. Because incomplete cuff inflation can lead to inaccurate measurements, fully automated devices are preferable in settings where less skilled staff are measuring blood pressure. Third, the clinical setting must be considered. For example, hospital clinics with a large patient volume should use devices designed for high-volume use. These devices, also termed professional or commercial devices, are typically valid for about 100,000 measurements, so they can last for up to 2 years when duplicate measurements are taken on 100 patients per day. In contrast, devices for home or personal use can typically perform well up to 30,000 measurements, and thus would only last for half a year in the same setting. However, these personal use devices can be acceptable for clinical settings with low volume. If you need electronic data transmission, some devices have wireless connectivity. Fourth, the characteristics of the patient population in the clinic or hospital should be taken into account. If clinics see a large proportion of individuals who are overweight or obese, devices with an appropriate set of cuff sizes are needed. Cuffs are a critical aspect of blood pressure measurement, but their importance is often overlooked. Using a cuff that's too small will give falsely high blood pressure readings, while a cuff that is too large will lead to falsely low blood pressure readings. In clinic settings where overweight and obesity is uncommon, using just one cuff, the standard adult cuff, is likely fine, because it will fit the majority of the population. Pregnancy and cardiac arrhythmias are other clinical conditions that might impact device selection. Clinics serving pregnant people may want to select an automated device specifically tested in that population. Specialty clinics serving patients with arrhythmias may prefer manual devices, or have manual devices available, as automated devices may not be accurate in these patients. Fifth, the resources available at your facility to support the purchase and maintenance of an automated device should be considered. This includes budgetary considerations as well as regional device availability and service. Blood pressure devices that are available from a regional manufacturer's office or distributor will usually be less expensive and may offer greater device support. Bulk purchasing can also lower costs. A professional, high-volume device requires greater initial expense, but lasts longer than personal use devices, potentially resulting in lower long-term costs in busy clinics. Sixth, The most important factor to consider when choosing an automated blood pressure device is whether the device has been validated for accuracy. Automated blood pressure devices use device-specific programs to estimate blood pressure, and therefore it is essential for manufacturers to formally test the accuracy of blood pressure readings by each individual device. There are several established test protocols that can be used for the validation of blood pressure devices, such as those listed here. You should only purchase a device that has passed a validation test. You may be surprised to learn that many devices on the market have not been formally tested for accuracy. Manufacturers can decide which test protocols to use. However, it is best to purchase a device that has passed one of the AAMI, ANSI, ISO validation protocols and/or the BHS protocol. Determining if a device underwent validation and which test protocol was used can be most easily done by referencing websites endorsed by professional societies such as Stride BP, the British and Irish Hypertension Society, Hypertension Canada, or the American Medical Association. We would like to emphasize the importance of blood pressure cuffs in the context of validation as well. The cuff should be made specifically for the device, as the device-specific programs to estimate blood pressure are linked to a specific device cuff. Use of off-brand cuffs from other manufacturers may therefore lead to inaccurate readings and should be avoided. Okay, so let's summarize the 6 key factors to consider when selecting a blood pressure device. 1. What source of power is available? 2. What is the skill set of the personnel who will be using the device to measure blood pressure? 3. What are the blood pressure measurement needs of your clinic? 4. What are the characteristics of the patients at your facility? 5. What are the resources available at your facility to support the purchase and maintenance of an automated device? 6. And the most important factor, is the device validated?